there are traditionally 3 different incisions. The most common is the inframammary fold in the breast fold region, which is hidden when you stand up. It's in the shadow of the breast and heals very nicely in most skin types. The second is what we call the periareolar, which is on the lower, typically edge of the pigmented nipple areola skin junction. And it's usually a crescent smiley face incision, and that heals very well too. The third, which is one that I really like, I think it's great, is called the transaxillary or the armpit incision. And it's again about a 1.5 inch incision in the armpit, and you use a special camera system to make a pocket under lighted magnification. So the benefit of that in my hands are that we use a camera system, a bright light, and everything is magnified, and we use very precise instruments and can create a very nice pocket and a very nice position of the implant with no visible scar on the breast. Some of the concerns about each individual scar are really as follows. The periareolar scar has the highest rate of losing nipple sensation, and it has a higher rate of what we call capsular contraction, which is a hardness or firmness of the implant, which you really don't want. So periareolar has the highest risk of that, and for that reason, it's lower on my list of selected incisions. The inframammary, or the breast fold, really is the go-to for larger silicone implants or patients that have complex anatomy, because it really gives you the best visualization of the pocket and lets you really manipulate the tissue the most. So it's really the gold standard. The transaxillary or armpit is not offered by a lot of surgeons because the equipment is more technologically advanced, it's fairly expensive, and it is really a more difficult procedure to perform, so most surgeons don't learn it and don't offer it. It is something that I've done for literally almost 20 years now, so it's something that when somebody comes to my office and says, oh, everyone in town says you can't have a transaxillary incision, it's really because the doctor doesn't know how to do it, but it really is an excellent, superb procedure for the right patient.